Congratulations on your kidney transplant. Some important reminders for the first 3 months after transplant for you and your caregiver. Some important telephone numbers to know would be the UCI Health Transplant Office phone number, which is 714-456-8441. The office is open Monday through Friday from 8 a.m. to 4:30 p.m. If for any reason you have any urgent issues after these time frames, give our office a call so that the transplant nurse coordinator could be contacted. Another helpful number to have is the UCI Health Outpatient Pharmacy, which is 714-456-3699. They are open 7 days a week, and you will need to call the pharmacy for the hours of operation as they may vary. You may also call this phone number if you have any prescriptions that need to be refilled from the UCI outpatient pharmacy. The number to the UCI Medical Center Hospital is 714-456-7890. You will need to have labs drawn the same day of your clinic appointment for the first 3 months. Please do labs at 7 a.m. at the UCI Outpatient Lab located in Pavilion 3, Building 29. Please do your labs while fasting and take your tacrolimus Prograf dose after your blood is drawn. Clinic appointments are as follows. For the first month, you will have clinic twice a week on Monday and Thursday. On Monday, you will see the nephrologist, and Thursday, you will see the surgeon. For the second month, you will have clinic once a week on a Monday or Thursday. On the third month, you will have clinic every 2 weeks, and days can vary. After 3 months, you will have clinic every 2 to 4 weeks, and days will vary. Clinic appointments may take a few hours. Please bring something to read and eat while waiting to be seen by the transplant team. If you experience any of the urgent issues that will be discussed in the following slides, please give our office a call at 714-456-8441. If you notice any increased pain, redness, tenderness, warmth, bad smell, swelling, or drainage at site of surgery, if you're unable to take your medications or experience nausea, vomiting, or are unable to swallow your medication, if you have a temperature over 101 degrees Fahrenheit, severe diarrhea or vomiting, blood in the urine, decrease in urine output, difficult or painful urination, rapid weight gain or swelling, if your systolic blood pressure is more than 180 or less than 90 after checking 3 times. You may also change where you check your blood pressure to see if the number is different. If your heart rate is less than 50 or more than 100 beats per minute, if your blood sugar number is higher than 400 or lower than 70, please give our office a call. Call 911 if you have anything life-threatening, shortness of breath, chest pain. A reminder, if you receive care outside of UCI Medical Center, whether it be at an urgent care or a different hospital, please provide the transplant doctor's number at 714-456-8441 so we can discuss your care with the treating provider. After transplant, you will have some restrictions. There is no driving for the first month. No driving while taking pain medication. Do not lift more than 10 pounds for 6 weeks due to the risk of hernia. Exercise by walking or using a stationary bike when able to. Return to work in 4 to 6 weeks as tolerated, and this will be discussed during your clinic visit. There is no sexual intercourse for 6 weeks while your body is healing, and we ask that you use 2 forms of birth control to prevent infection. There is no traveling in the country for 6 months, no traveling out of the country for 1 year. We ask that our transplant patients wear sunscreen with both UVA and UVB protection of SPF 30 or higher to prevent skin cancer. Due to the transplant medications you are taking, you are at risk of infection. We ask that you please wash your hands often, wear a mask, and avoid sick people in crowds. There is no gardening or fresh flowers for the first 3 months. Gardening is allowed after 3 months if masks and gloves are used. Vaccinations. No vaccines for the first 3 months. After 3 months, only inactivated vaccines are allowed. No live vaccines. No routine dental care for 3 months. After 3 months, you may receive your COVID vaccine and flu vaccine. Please contact the transplant team before receiving any type of vaccination or if you have any questions or concerns. Healthcare after transplant regarding drugs and alcohol. There is no smoking, including marijuana, and avoid secondhand smoke. No use of alcohol. Ask your transplant doctor about edible marijuana if you have questions. Regarding pet care, do not handle animal waste for the first 3 months. After 3 months, cleaning up after pets is allowed if masks and gloves are used. Always wash your hands after cleaning or touching your pet. As always, if there's any questions or concerns, or any changes or issues with your health insurance, please give our office a call at 714-456-8441. Thank you for your time and watching our education video.